Today we have an unprecedented access to research and information which the general public are consuming at an increasing rate, and private companies are monetizing at an increasing rate. In this new wave of health exploration, we're seeing a rise in over-testing, over-diagnosis, and over-treatment. My name is Amara, I'm a 5th year medical student, and today I'm going to be debunking some of the myths and the hype that podcasts, wellness gurus, and non-healthcare professionals have created, and to make you realize that over-investment is not the answer to living longer and healthier, and in fact, it can actually lead to opposite results. In this video, I have to admit I'll be shamelessly biased, and I'll be disseminating the evidence that these private companies aren't showing you. Studies show a fascinating paradox that patients seem to be more satisfied the more tests and treatments that they receive. Why is this? Because it creates the perception that something is being done for their benefit. Yet many patients, and regretfully some healthcare professionals, don't realise that with every investigation, with every drug and intervention, however carefully it's carried out, inherently will pose some risks. These risks can lead to complications that change people's lives. Now, around 20 years ago, the medical world was introduced to a simple blood test, the PSA, otherwise known as the prostate-specific antigen. Fast forward to today, where over 1 million Americans have undergone treatment for a cancer that may never have bothered them, simply because they had an abnormal PSA. Now, I'm sure many of you would opt to excise a cancer that most likely is dormant, just on the off chance that it did turn into something metastatic. Now, what if I told you that the fallout from these interventions, in many cases, were quite serious and life-changing? Many of these men with abnormal PSAs opted for aggressive treatment, radiation or radical surgery. And here's a stark reality: almost a third of these men suffered permanent side effects, including the inability to maintain an erection, bowel and bladder incontinence, and inability to ejaculate. Now, undoubtedly, these effects will have psychological and physical consequences. Tragically, some of these men even lost their lives to a treatment that was meant to save them. So what initially seems like a proactive health screen can lead to a cascade of unintended consequences. The PSA case study shows how important it is that a doctor is able to explain the risks and side effects associated with an intervention. Now, what happens when you remove the healthcare professional and you get consumers and the general public purchasing these tests directly from a private company? Now, I've been wanting to talk about the rise of Zoe ever since my whole social media and personalized ads have been bombarded by their adverts. Now, for those of you that don't know, Zoe is a company that offers continuous glucose monitoring as well as a gut microbiome screen. Now, they've made some impressive claims, claiming to help users reach a healthy weight, feel less bloated, and avoid chronic health issues. Ask any doctor what they think and they'll roll their eyes. Now, continuous glucose monitoring, otherwise known as CGMs, have transformed the lives of many diabetics, reducing the incidence of acute emergencies such as hypoglycemia, improving maternal and fetal outcomes in gestational diabetes, and empowering diabetics to manage their blood sugars and therefore the acute and chronic complications that come with it. Their use in people that aren't diabetics, however, seriously lacks evidence, and in fact are associated with unhealthy diets and health anxiety. So how do CGMs work? Basically, the monitor will measure the glucose that is surrounding your cells and link it to an app where you can see how your blood sugar levels rise and fall with different foods and throughout the day. The idea is that you'll be able to see which foods cause a greater rise in your interstitial glucose, and therefore you'll know which foods you tolerate or tolerate less, and therefore which foods to avoid. They think that this is paving the way towards a personalised diet. Now, I'm sure you'll agree that a healthy diet is about so much more than sugar. And in fact, if you determine what makes a healthy diet based on your blood sugar, by that very same logic, you could eat a diet that is very high in saturated fats, let's say full of sausages, and you'll be able to see that your blood glucose sugar doesn't rise very much. Now, does this mean you're eating a healthy diet? Absolutely not. Thus, by eating foods that are high in saturated fats but not sugar will actually lead to cardiovascular complications rather than diabetic ones, increasing your risk of heart attacks, strokes, and high blood pressure. On the other hand, people may actually avoid foods that are good for them, like milk, nuts, fruits, based on the fact that they do cause a significant rise in glucose. These foods, however, actually have an immense cardiovascular benefit, as well as containing vitamins and fibre that you need for a healthy lifestyle. Did you know that glucose variation is actually very normal, and young lean adults will actually experience rises in glucose that are diagnostic of diabetes after eating a meal, despite not having diabetes at all? So someone may see that the diabetic cutoff for high blood sugar or diabetes is 11.1 and think, that's it, I have diabetes. But getting a one-off value of 11.1 is very different to the chronic high blood sugar levels that type 2 diabetics experience that leads to the manifestations of that disease. When you last went to the gym, sleep, and the composition of previous meals will all affect the glucose reading you get from the CGM for the same exact food. The combination of these factors makes it very difficult for someone to determine the true effect that a specific food has on their glucose levels. So I hope I'm slowly convincing you that our bodies are a lot more complex than these private companies like to give credit. This is even more the case when it comes to gut microbiome testing. Since the publication of the Human Gut Genome Project in 2012, our understanding of our gut microbiome and its association with health and diseases has increased. And with it, the general public's interest in how they can alter their gut microbiome to reduce the risk of some chronic diseases and make themselves healthier has also increased. I'm sure you guys have even seen adverts for gut microbiome testing or probiotics. By taking a fecal sample and reading your gut microbiome, private companies claim to be able to determine whether this is healthy or not and suggest lifestyle changes and supplements in order to fix any abnormalities. Now, you may not know that the large bowel is home to over 100 trillion bacteria, and that's not even including the viruses and fungi that will also be found there. Now, these tests may actually pathologize bacteria that can actually be beneficial to us. For example, E. coli is a strain of bacteria that a lot of the time is beneficial and not harmful at all to our gut. It aids digestion and protects us from other harmful microbes. And the extensive genetic variation that the E. coli strain possesses puzzles medical researchers, making it harder to say that yes, E. coli is specifically causing this disease, or is the fact that this disease is present causing increases in the E. coli population of the gut. And whilst research has hinted at some links between the gut microbiome and chronic diseases such as inflammatory bowel disease, IBS, non-alcoholic fatty liver disease, even colorectal cancer, the current body of evidence does not provide a standard gut microbiome and therefore does not serve as a baseline for health. And thus, we can't draw any definitive associations between certain gut microbiome species and specific diseases. And let's keep in mind that the gut microbiome is only one factor in all of these multifactorial complex chronic health issues. Now let's shift our focus to a couple case studies that show how overinvestment does not necessarily yield better results. Undoubtedly, in poor countries, more money and investment in health will inevitably increase life expectancy. But what happens on the other end of the spectrum? Did you know that the United States spends more on healthcare than any other country in the world? In fact, it spends twice as much per person than developed countries like Sweden and Denmark, but has a life expectancy that is lower than the likes of Sri Lanka, Algeria, and Puerto Rico, which spend far less per person on healthcare. That raises an important question. Does spending more money on healthcare necessarily lead to better outcomes? Perhaps the poster boy of health overinvestment is Brian Johnson, the entrepreneur that spends $2 million a year with the main aim to live longer. Now, I have here that he has measured all of his 70 organs and with a team of doctors and scientists is trying to reverse the quantified biological age of each. To do this, he takes 111 pills a day, wakes up at 4:30 am, finishes all his meals by 11 am and goes to bed every night alone purposefully. Now, I'm not half as qualified as the team of doctors that he pays for, but to me it seems he has sacrificed a quality of life for an obsession with health and living longer. This in many ways reflects the mindsets of people suffering with eating disorders, where their whole life becomes about health and specific numbers to do with their body, to the point where they isolate themselves from other people. Personally, I think the millions of dollars that he's investing will lead to negligible increases in his life expectancy. Now let's take a look at cold water immersion and cryotherapy. Two therapies that people strongly swear by because they supposedly lead to better recovery after physical exercise and reduce inflammation. The idea is that cold therapy reduces blood flow to the peripheral tissues, thus reducing the metabolic rate of these tissues, inflammation, and consequently inflammation-mediated damage. Now here's my problem with these studies. A lot of these studies will use something like neutrophil count, which is a type of white blood cell, as a marker of inflammation. Now, although a lot of studies show a correlation between something like cryotherapy or cold water immersion and reduced neutrophil count, we cannot jump to the conclusion that this means the person has improved function or improved recovery or improved symptom control. Now, we don't want to fall into the trap of treating people as numbers. Now, something that highlights this beautifully is osteoarthritis. Now, in clinics, I see so many people which, let's say, are bedridden by the pain, the joint pain that they have, right? They can't walk, they're limping all the time. You look at their x-ray and the x-ray is fine. The x-ray is beautiful, it shows no sort of osteoarthritic changes. Conversely, you'll see someone based on their x-ray first without having met them, which will show, you know, sclerotic changes, basically two bones rubbing against each other, there's no cartilage there anymore, but they will be asymptomatic. And obviously, it makes sense to treat someone based on their symptoms, not what the x-ray shows. Secondly, I feel like people are very quick to demonize something like inflammation. Now, the reason that inflammation has stood the test of evolution is because it helps us heal from physical trauma, infections, and even malignancy. If it wasn't for inflammation, every scab, paper cut, fracture you'd ever experience would still be there and may have even cost you your life. Of course, in some conditions like autoimmune diseases such as rheumatoid arthritis, that's where inflammation goes a bit haywire. But in healthy people, inflammation shouldn't be something to be scared of. And actually, after the gym, when we do experience local muscle tears, inflammation will actually help us heal from those muscle tears. And studies have shown that impeding that inflammatory process by something like cold water immersion or cryotherapy can actually make healing take longer. Also, not one size fits all. My grandma does cold water immersion by having really cold showers in the morning, but without realizing it was making her chilblains worse. Now, chilblains is a condition where elderly people, when exposed to the cold, get vasoconstriction, meaning their vessels shrink in their extremities, causing blueness of the skin, pain, and unknowingly, those cold short showers were exacerbating those symptoms. Lastly, a paper published in 2017 found that cold water immersion was no better than active recovery in reducing inflammation after exercise. Adding to that, studies have also shown that cryotherapy is no better than cold water immersion in recovery of muscles. Now, why does this matter? Cryotherapy will involve you stepping into a chamber that's set at around -80 degrees Celsius and will set you back about £50 a session. Now, all this money, when research shows that a good stretch after you work out that costs £0, is actually just as good as all these expensive therapies. It's important to shift our focus back to evidence-based practices that have stood the test of time. Whenever I see these Zoe adverts, I always think to myself, what do people think they're going to learn that they don't already know? Do they think they're going to be able to eat a chocolate cake and miraculously they're the only human in the world that after eating a chocolate cake their blood sugars don't rise? Of course not. It's going to tell you that yes, sugary foods lead to greater rises in blood sugar. The truth is, no technological device will find a loophole to living longer while simultaneously adopting unhealthy habits. And then on the other side, I see people going on these fad diets where they cut out all carbohydrates from their diet or go on a liquid-only diet, and I think surely you realise that that's so much harder to do than just to have a healthy, balanced diet. Take the Mediterranean diet, made up of fruits, vegetables, grains, nuts, oily fish, vegetable oils, that has been proven to greatly improve our cardiovascular health and enhance overall well-being. Now, the second secret to living longer is something that I already know you know what I'm going to say: exercise. Now, regular exercise not only helps in weight management and tones muscles and is good for the heart, it improves mood, and in high-risk groups like the elderly can reduce falls by stabilizing joints. And what I realize is that we're living in a society that spends so much on these novel health technologies and new fads and therapies, and we're overlooking the fact that we're all surviving on 5 hours sleep, sitting down for over 8 hours a day, and being stressed and anxious all the time. And in fact, these are the real silent killers that are going to shorten our life expectancy. In conclusion, as we navigate through the future of health, let's not forget the fundamentals. Simple habits and practices that have stood the test of times and have tons of evidence behind them. Why should we put those to one side and instead go for interventions, tests, and therapies that are very expensive, have a lack of evidence, and are not going to lead to the better results? If you found this video interesting, please make sure to like, subscribe, and turn on the post notifications for more health content.